ज़्यादा जानकारी हासिल करना, कैसे आप अपने आप को टेस्ट कर सकते हैं, कैसे मेडिकली क्या-क्या टेस्ट अवेलेबल हैं, इज़ इट क्यूरेबल, नॉट क्यूरेबल, व्हाट आर योर प्रोस एंड कॉन्स, व्हाट आर योर ऑप्शंस, ये सब चीज़ें जानना बहुत ज़रूरी है। So for this reason, I would like to welcome Dr. Kanchan Kaur, who's Director Breast Surgery at Medanta Hospital in Gurgaon. She's a gold medalist and has trained at specialist breast centers in the West. She helped establish the breast clinic at Medanta, which is one of its kind. She's very passionate about public awareness centered around early detection of breast cancer and is extensively involved in community outreach programs. She trains blind girls to become medical tactile examiners and is tutor on the government online learning platform Swayam. She has also contributed to breast cancer awareness section on the M Shakti mobile app launched by Indian Cancer Society. So very warm welcome to you, Dr. Kanchan.
Good afternoon, good morning. I think it's still good morning. Hi, Chavi. Thank you so much for the lovely introduction. So, जैसे कि आपने कहा, it is so important, and I can go hoarse saying this that जितना भी हम breast cancer awareness के बारे में बात करें, उतना भी कम है. Because, as you said, the statistics 1 in 28. You know, in the Western world, US or UK में 1 in 8 women get breast cancer. So it's way much more common. Lekin, in India, there are way many more deaths due to breast cancer than there are in the West. So actually, 1 in 2 women in India who are diagnosed with breast cancer will lose their life to breast cancer within 5 years of diagnosis. Whereas bahar ki countries mein, the success rate of treatment is up to 90 to 100%. And this difference is not because India में doctors नहीं हैं या treatment नहीं है. The only difference is lack of awareness. The only difference is कि हम लोग इलाज से इतना डरते हैं कि हम बीमारी को पता ही नहीं करना चाहते. You know, that is the biggest thing. We are too scared to come forward to do the tests. So 80% and more women present with late stage disease. And that is why we are unable to give them the kind of cure rates that the Western world sees.
Wow, this is really I had absolutely no idea. मतलब I'm sure there'll be a lot of other things which we'll discover in today's session, but this is amazing कि अगर आप जल्दी उसे डिटेक्ट कर सकते हो तो काफी चीजें हैं जो आप कर सकते हैं. And I'm sure audience भी जो हमें join कर रही है, they'll have a lot of questions for you, Dr. Kanchan. But before we begin with audience questions, I have a lot of questions of my own. तो
Yeah.
सबसे पहले तो ये बताइए कि ब्रेस्ट कैंसर का कॉज क्या होता है? जेनेटिक होता है या सिर्फ जेनेटिक होता है कि और भी कॉजेज होते हैं?
So, you know, all experts get stumped when they get asked this basic question because nobody really knows. Okay, there are multiple factors that lead to breast cancer. So, genetic is just a small component. Genetic as in familial, कि आपकी family में किसी को था और आपको हुआ, तो वो gene abnormality है जो हम केवल 10 to 15% ladies में we are able to detect. In about 80 to 90% women, there is no family history. So there is no familial basis. So you know, a lot of women जब हम उनको कहते हैं आके टेस्ट कराइए, they say हमारे घर में किसी को नहीं था तो हमें नहीं होगा. So that is the biggest myth. Because up to 90% breast cancer can happen in those women who do not have a family history. So what are the causes that we believe lead to it? So it is a
But
lifestyle.
I'm sorry to cut you. Does that mean कि जिनकी family history में breast cancer है, उनके chances इससे भी ज़्यादा हैं to get breast
Absolutely.
cancer?
So I'll come to that. So when we're talking of the causes, so genetic, we keep on one side, which is familial, which is a small proportion of the cancers that we see. So majority women, we know it is a lifestyle disease. That is why jitna hum westernize hote ja rahe hain, India maybe the risk of breast cancer is increasing. So interestingly, metropolitan cities like Delhi, Mumbai, Chennai see way much more breast cancer than a village sees, because we live a different kind of a lifestyle. So environmental factors, not having kids up till the age of 30, so late childbirth, बच्चों को दूध नहीं पिलाना, which is breastfeeding नहीं करना, weight ज़्यादा होना, exercise नहीं करना, not eating healthy food, not getting the right kind of sleep, because there is a circadian rhythm that the body follows. तो अगर आप उतने घंटे आराम नहीं कर रहे हैं, the body is stressed. So stress, inflammation, all of these things get together to give rise to breast cancer. So because there is no one single cause that we can talk about, the maximum that you can do is learn to improve your lifestyle, so that you can control it, and also be very aware of early signs. अब जिनकी तो family history है, they must go to their oncologist as soon as they know that they have a strong family history, because उनके लिए हम बहुत early test शुरू करते हैं, because the lifetime risk of developing breast cancer in somebody who is gene positive, you know, Angelina Jolie made the BRCA genes very famous.
Yeah.
So अगर उनमें वो gene है, तो उनका lifetime risk 85% है to make a breast or an ovarian cancer. And that is why sometimes we remove the breasts and ovaries of these women, even if they don't have cancer, because we are preventing it.
But tell me something कि ऐसा भी होता है कि आपकी फैमिली हिस्ट्री में कोई भी कैंसर है, so you're more prone to any kind of cancers and hence also breast cancer? Or is it only because somebody has breast cancer in your family that is what increases your risk?
So that's a very, very good question. The thing is that there are different genes that lead to different types of cancers. So इसमें जो breast cancer cause करने वाले जीन हैं, वो generally ovaries का cancer और prostate का cancer करते हैं. So अगर आपकी family में किसी को ovarian cancer है, तो then we also think of breast as a high risk. So there are other genes that lead to different types of cancers. And that is why if somebody has a family history of cancers, we tell them to get genetic counseling. And the counselor then looks at कौन से organ का cancer था, कौन सी gene इसको कर सकती है, and that is why they have that kind of a genetic test to understand if they have an abnormality.
Okay, I get that. And what is inflammatory breast cancer?
Okay, so inflammatory breast cancer is one of the rarest forms of breast cancer. Inflammation का मतलब है infection के signs, right? So normally जब breast cancer होता है, and we'll talk about the symptoms I'm sure as we go along, most of the times इसमें कोई symptom नहीं होता है. If you have a lump in the breast, you don't even know because it's not hurting. But inflammatory breast cancer में you develop pain and redness on the breast. And sadly, Chavi, I'd like to tell you that even doctors in the community will miss this as an infection of the breast, and the patient will be given antibiotics. पर वो अगर 5 दिन 10 दिन तक अगर ठीक नहीं होता है, that is what we tell women, that if you have redness of the breast, which is a rare form of a breast cancer, तो और वो हफ्ते 10 दिन में ठीक नहीं हो रहा है with antibiotics, you must go to an oncologist, because we will look at everything with a very high degree of suspicion. But any woman seeing a bit of redness on the breast, please don't get scared. We are not here to scare you. But if you have any doubts, make sure you go to your doctor.
So then, okay, redness तो एक चीज होगी, but what are the symptoms of breast cancer? मतलब ऐसी कौन सी चीजें हैं जो शुरू में develop होती हैं और
So the thing with breast cancer is, Chavi, you know, luckily or unluckily, breasts are external organs. Sadly, जितना हमको इनको with an eye of understanding changes in the breast examine करना चाहिए, हम नहीं करते. And the biggest symptom of breast cancer is a lump in the breast, which is painless. And I really want to stress upon this. I hear this so many times in clinic. Women come, they say, डॉक्टर साहब हमें साल पहले गांठ फील हुई, इसमें दर्द नहीं था तो हमें लगा ये कुछ नहीं है, अब ये गांठ बढ़ गई है इसलिए हमें लगा कि हम डॉक्टर के पास जाएं. So 90% of the time a painless lump in the breast could be a sign of something sinister. So it's very, very important to understand. You know, ये हिंदी फिल्मी मूवीज की तरह नहीं होता कि कैंसर हुआ तो खून की उल्टी आएगी और बहुत कुछ ड्रामेटिक होगा, ऐसा कुछ नहीं होता है. You have a lump in the breast which is growing, and अगर आप regularly खुद को check नहीं करती हैं, you will not be able to feel it till it becomes the size of a lemon, and it starts as a rice grain size, you know. So a lump in the breast, nipple से खून या पानी आना, even one episode of blood or watery discharge from the nipple is not normal. Please don't come and tell a doctor 3 महीने पहले blood आया था फिर बंद हो गया तो मुझे लगा सब ठीक है. Even a single episode of blood or watery discharge is not normal. But if you get milky discharge, green discharge, or yellow discharge, that is normal. That is not a sign of cancer. Blood and water could be. Nipple का अंदर की तरफ धंसना. So all women, most of us have nipples that point outwards. कईयों की पैदाइशी निप्पल अंदर की तरफ होती हैं, उसको हम कंजेनिटल इन्वर्जन बोलते हैं. बट अगर आपकी निप्पल अंदर की तरफ नहीं थी एंड सडनली एक निप्पल अंदर की तरफ खिंचना शुरू हो गई है, दैट कुड बी अ साइन ऑफ ब्रेस्ट कैंसर एज वेल. निपल के ऊपर घाव होना जो ठीक नहीं हो रहा है, एनी अल्सर ऑन द निपल दैट विद लोकल ऑइंटमेंट्स, डर्मेटोलॉजिस्ट को दिखा दिया, गायनी को दिखा दिया, ठीक नहीं हो रहा है, must be checked by an oncologist. And as you mentioned, the rarest type of breast cancer, which is inflammatory breast cancer, जिसमें breast पे redness है, breast की consistency thick हो गई है, एंड क्योंकि लेडीज कई बहुत लेट आती हैं, वी हैव अ फैंसी टर्म फॉर दिस, इट्स कॉल्ड द प्यूडियोरांज, व्हिच मींस संतरे की स्किन जैसी स्किन हो जाती है ब्रेस्ट की, कि उसमें ऐसे छेद दिखते हैं और थिकंड होगी होती है. दैट इज अ वेरी एडवांस्ड स्टेज ऑफ कैंसर. Most women, if they regularly self-examine, can pick up a lump which is 2 centimeters in size.
Tell me then, what is the
I lost you there, Chavi. Did you want to ask me what is the right time to start examining?
what is the right time to start examining or start screening for breast cancer, and what are the tests that are available that you can get done?
Okay, so I'll tell you a very interesting story. 12 years back, when I came back to India, I realized women were coming late. I need to do more and more awareness. So I went to communities, I went to satsangs, I went to places where women 40, 50 and above are, right? Everything I said fell to a deaf ear. They would listen to me and they would go home and never come for screening. So then I realized that, if I talk to younger girls, it's going to make a difference. Why? Because if I tell a 16-year-old that your mom has taught you how to thread your eyebrows and look beautiful, how to get your arms waxed ever so often, but she's never spoken to you about self awareness. And I think girls as young as 16, 17 should be taught that once a month, every month, you should self examine. And when I started going to colleges and schools, will you believe it? These girls dragged their mothers and aunts out for tests to clinic. So, self examination with your own hands once a month, every month, from the day you develop breasts. Agar, if you make this a habit, you'll never forget it. Also, Chavi, I want to point out here, when we were talking of statistics, India may sadly, breast cancer happens at an earlier age than it happens in the West. So whereas in the US, breast cancer peaks in the 5th and 6th decade, वहाँ 50s or 60s में ज़्यादा breast cancer होता है, India में the peak age is 40 to 50. And in fact, even girls under 40, India में 16% of breast cancer happens in girls who are under the age of 40. I have operated on a 24-year-old 2 days ago. So it can happen that young. So if you're aware of yourself from the age of 16 onwards, I'm not here to scare you. Breast lumps in young girls are most often not cancer. But if you are aware of any changes in your breast from early on, you will never come late. And that is what we are fighting in India. We are fighting the fact that women are not coming in time. So I repeat myself again and again, self-examination once a month, every month, for every single woman. Those who have periods should do it after their periods finish, because before that the breast is tight and tender. Then from the age of 40 onwards, we recommend कि आप लोग ब्रेस्ट के लिए एक एक्सरे कराएं, जिसको मैमोग्राम बोलते हैं. इट्स कॉल्ड अ स्क्रीनिंग मैमोग्राम. इट्स एन एक्सरे ऑफ द ब्रेस्ट, जिसमें ब्रेस्ट को शीशे की प्लेट पे रख के दूसरे से थोड़ा दबाया जाता है, एंड वी गेट अ फुल फिल्म. Now women come and say ये बहुत painful procedure है. So I always tell them, you have to have it done once a year or once every 2 years, and it takes all of 10 seconds to do a mammogram. So it's not painful, but it is uncomfortable. But I really, really want to tell you all that, it's this little discomfort could save your life. Because bahar ki countries mein, from the day a woman turns 40, she gets invitation letters from the government to say, your mammogrammable age, come and get your mammogram. और क्योंकि वहां पर रेगुलर स्क्रीनिंग होती है, जो कैंसर है जब वो चावल के दाने जितना छोटा होता है, फ्यू मिलीमीटर्स का होता है, तब पकड़ा जाता है, तब तो हाथ से भी नहीं फील होता. एंड दैट इज स्टेज 0 और स्टेज 1 कैंसर, which carries 100% cure rate, 90% cure rate. Whereas if you wait for this चावल का दाना to become a राजमा का दाना, to become a नींबू का size, to become a golf ball size, by that time what happens? The cancer spreads. And if the cancer spreads, then it is very difficult to control it. And the example, Chavi, I like to give here, जो लोगों को समझ आता है, that it is like दीमक. अगर आपके घर में दरवाजे पे दीमक लगी है, यू विल नॉट वेट फॉर द होल दरवाजा टू गो खराब बिफोर यू चेंज इट. इनफैक्ट जिन लकड़ी को दीमक नहीं भी लगी है, यू विल ट्रीट दैट. व्हाई? बिकॉज यू नो ये हिडन सेल्स हैं जो स्प्रेड कर सकते हैं, एंड कैंसर इज एग्जैक्टली लाइक दैट.
वाओ, that was very well explained. बट आप बोल रहे हो कि घर पे सेल्फ एग्जामिनेशन अर्ली एज पे शुरू करना चाहिए, ये करना कैसे होता है? what is the right way to do a self examination?
So there are so many videos on YouTube now, and you can find it online, but I'll go through the steps. So the first thing you have to do is stand in front of a mirror. So look, देखो. And Chavi, I get asked at awareness talks, कपड़े उतार के खड़े होना है या कपड़े पहन के खड़े होना है? I actually get asked that. Okay. So you have to undress and stand in front of a mirror and look. And while you're looking, you have to take your hands above your head, put them on your waist and push into your waist like this. So hands above your head, on your waist and push into your waist. जब आप ऐसे कर रहे हैं तो आपको अपनी ब्रेस्ट की तरफ देखना है, और ऐसे करते हुए अगर ब्रेस्ट में कोई डिम्पलिंग हो रही है, गड्ढा पड़ रहा है कि खिंच रही है स्किन अंदर, या सडनली कोई प्रोमिनेंट लंपीनेस दिख रही है, सो यू हैव टू बी अवेयर ऑफ दैट. सो दैट्स लुकिंग. यू कैन ऑल्सो सी कि आपकी निप्पल अंदर की तरफ तो नहीं जा रही है. सो दैट इज लुक. उसके बाद है फील. एंड फील यू कैन आइदर डू वाइल स्टैंडिंग अप, वाइल यू आर टेकिंग अ शावर, साबुन लगाते हुए, या बेड पे लेट के. बेड पे लेट के अगर कर रही हैं, पुट अ पिलो अंडर योर शोल्डर्स. उससे क्या होता है कि ब्रेस्ट ऊपर की तरफ उठती है. नाउ जिस हाथ से आप एग्जामिन कर रहे हैं, उसकी ऑपोजिट साइड की ब्रेस्ट को आप एग्जामिन कर रहे हैं, राइट? सो अगर आप लेफ्ट साइड को एग्जामिन कर रहे हैं, यू यूज योर राइट हैंड, एंड द लेफ्ट हैंड शुड गो बिहाइंड योर हेड. Okay, so left hand behind your head, with this hand you examine your breast. Now always remember, अगर आज जैसे लेडीज ये देख रही हैं, किसी को एकदम से होता है अच्छा मैं खुद को एग्जामिन करूं, द बिगेस्ट मिस्टेक दे विल मेक इज, आई एम गोइंग टू शो इट विद दिस. इफ दिस इज द ब्रेस्ट, दे आर गोइंग टू होल्ड द ब्रेस्ट लाइक दिस, और उसमें क्या होगा, यू विल फील योर मिल्क ग्लैंड्स, and suddenly you'll be like, oh my god, मेरी तो breast में इतनी गांठ है, मैं नहीं examine कर सकती, right? So it's always the flat of the hand running on the surface of the breast. जैसे हम किसी का सिर सहलाते हैं, right? So if this is the breast, flat of the hand, 3 उंगली से pressure के साथ बाहर से निप्पल की तरफ ऐसे करते हुए आप पूरी ब्रेस्ट को कवर कीजिए, and then press your nipple to look for any discharge. Green, yellow, white is normal. Blood and watery is not. So these are the simple ways to look for lumps in the breast. Now I get asked a lot of times, हमें कैसे पता लगेगा कि वो गांठ है? So अगर आपने कभी खुद को एग्जामिन किया ही नहीं है, you do not know what is normal for you. If you don't know what is normal, you will never know what is the abnormal. So practice के लिए घर पे आप क्या कर सकती हैं, जो फ्रोजन मटर का पैकेट आता है ना, फ्रोजन पीस का, आप उसके अंदर नींबू को डाल दीजिए, and then you run your hand over it. So the whole packet feels lumpy, but वो मटर का दाना हाथ के नीचे slip हो जाता है because it's like the normal milk gland. But the moment your hand will run on the lemon, you will know ये कुछ अलग है. So you will come to know if you regularly self-examine.
So tell me, जो normal non-cancerous जो benign lumps जो होते हैं, वो normal होते हैं? Like is it okay? How many like roughly how much percentage of women should have a normal lump?
80% of all lumps we see in the breast are not cancer. Okay. so
So how do we
but
know that this
yeah,
is cancerous?
you go to a doctor. This is what I tell everybody, right? But when you feel a lump, cancer का lump जो होता है बहुत hard होता है. But then that only a doctor can tell. You don't know what is a soft lump. You've never felt a soft lump. A doctor has felt a soft lump and a hard lump, so they can make the differentiation. जो soft lumps होते हैं, fibroadenomas, in fact, छवि young girls में बहुत होते हैं, and they're called breast mice because they move around in the breast. Whereas जो cancer होता है, tends to be more stuck at one place. But younger age में जो cancers होते हैं, they're more aggressive, and they tend to clinically and on ultrasound look like a benign lump. So that is why it's very, very, very important to make sure that if you have a lump in your breast, you go to a specialist, पता कर लो कैंसर की गांठ है नहीं है, and if it is not, हम तो उसको निकालते भी नहीं है. Benign lump can be left in the breast without even needing surgery or treatment.
Yes, absolutely. And I'd like to add there, when I was a child, I had a lump in my breast. I still have it, and it's just sitting there. And
Absolutely.
I think I understand what you say when it's a soft lump. It's a
Yeah,
soft lump and it moves around.
it
Yes,
moves around.
yes, I know what you mean.
Yeah.
So अब ये बताइए जिसकी वजह से आपको कैंसर हो सकता है या something that you should avoid.
So I lost you for the first bit of the question.
Okay, so I'm asking that can a certain kind of bra also cause breast cancer?
No. This is the
No.
biggest myth. Okay. Wearing a bra, not wearing a bra, underwired, padded, black has no bearing on the risk. But a word of caution here. The Indian environment is not meant for synthetic padded and underwired bras. So if you're wearing a synthetic padded or underwired bra and you're walking out in the humidity of the Indian climate, then you're doing yourself a big disfavor. Okay. So what happens is that we are seeing a lot of girls, younger girls, with infection in their breast. Why? Because their nipples are constantly pressed because of wearing a tight bra, they're sweating inside their bras, and that causes infection. So, in the Indian scenario, wearing cotton is a better idea. It has got nothing to do with cancer, but definitely risk of infection increases if you're not careful about what you're wearing.
And tell me that is breast cancer something that can also affect men?
Yes. So if we
Okay.
see 100 breast cancers, then one will be a man. 1% of breast cancer happens in men. And again, Chavi, because even doctors are not suspecting it in the community. So unless a specialist sees a man with a lump in the breast, generally it can get missed. So men should be very aware, especially if they have a family history of breast cancer. And if a man gets a breast cancer, then the risk for his kids, especially daughters, is much higher than if the mother of the kid has breast cancer, because it's more likely to be genetic.
So then how do do you think men also should self-examine themselves every now and then?
Chavi, I've spoken to my kids' school teachers as well about this. I really think it is important for kids to be taught about self awareness. Bleeding from any site is not normal. Any lump anywhere in the body must get checked out. So, whether it's a man or a woman, right, you
Hmm.
must be aware of what could be the symptoms of a disease, not necessarily cancer. Okay. So, if you've coughed और उसमें खून आया है, या किसी पोस्ट मेनोपॉजल लेडी को स्पॉटिंग हो रही है, या किसी आदमी को अपनी छाती पे लंप फील हो रहा है, even men can come with nipple discharge. So we should all once a month take some time to examine ourselves. अपना मुंह खोल के अंदर देखिए कोई अल्सर्स तो नहीं है. Examine your breasts. Make sure you don't have any lumps or bumps anywhere. And if you do, go and get themselves checked out.
Okay, that makes sense. And what are the different types of breast cancers? क्या-क्या होते हैं और अलग-अलग stages क्या होते हैं? कैसे progress करता है?
So, we have this saying which says that breast cancer is one diagnosis, but it is not one disease. Okay. And it's important to know that. Why? क्योंकि मैं एक पेशेंट की ट्रीटमेंट कर रही होती हूँ और वो कहती है पर मेरे मोहल्ले में एक लेडी है उसको तो कीमो नहीं मिली, उसकी तो सर्जरी में ब्रेस्ट निकाली. So every patient is very very different. So types of breast cancer, obviously there's a huge atlas of pathology, but what we have to understand is that the commonest breast cancer is what is called a ductal carcinoma. Ductal, why? Because it arises in the ducts of the breast. तो breast के अंदर glands होते हैं जहां दूध बनता है, and there are straw-like structures called ducts जो उस दूध को निप्पल तक लाते हैं. And about 80% of breast cancer happens within these ducts. And there are other types of cancers, lobular carcinomas, and different types, which obviously I don't need to go into. But when we talk of stages of breast cancer, so there are 4 stages. Stage 1, 2, and 3 are limited to the breast and the lymph nodes in the armpit. Stage 4 is when it has gone to another organ in the body. So if you have a cancer in the breast, and we also see a cancer in the lung, which we prove is arising from the breast, so it becomes a stage 4. The earlier stage that we pick the cancer in, the easier it is to treat, the higher the success rate. And we come back a whole circle to what we started this conversation with, कि अगर आप self examination करते हैं, routine screening करते हैं, so you pick up cancer in stage 0 and stage 1, when doctors will tell you very confidently that this is curable.
Oh, okay. That was my next question. How curable is it?
If it's picked up early, it is. There are those outliers who have very aggressive disease. Even if it's picked early, they don't do well. But that is a very rare, small population. Majority women who are picked in time, and I'm quoting Western data here, 90% survival rates for breast cancer detected in stage 1 and 2.
ओके, ओके। तो अब मुझे ये बताइए डॉक्टर कि कुछ ऐसा भी हम कर सकते हैं जिससे कि हम ब्रेस्ट कैंसर कंप्लीटली अवॉइड कर दें या एटलीस्ट रिस्क उसकी डिक्रीज कर दें डाइट के थ्रू या लाइफस्टाइल चेंजेस,
So
क्या
the
क्या कर सकते हैं?
so the only thing that can reduce the risk significantly is surgical removal of breasts, okay, which is only recommended to those जो BRCA gene positive हैं, जिनमें वो genetic problem है जिसकी वजह से breast cancer बन सकता है. For routine women, you know, it's difficult to say to women who are professionals कि आप जल्दी शादी करो, जल्दी बच्चे पैदा करो, ज्यादा बच्चे पैदा करो. It's not something that is feasible and practical, but having kids at the right age, preferably if you can have them under the age of below the age of 30. I can't say have a lot of kids, but I can definitely say when you have a child, please breastfeed. You know, Chavi, as our lifestyles are becoming more and more westernized, we are sadly becoming a population where women come and say, Mujhe doodh nahi aa raha. There is no such thing as Mujhe doodh nahi aa raha. You know, we are mammals. Mammals are meant to suckle their young ones, right? So, and I always tell everybody, you know, when your dadi nani say wo 40 days bed mein bacche ke saath raho, there's a reason. Because when the baby makes contact with your skin, it tells your brain that it needs to secrete the hormone that makes the milk. The moment you have a baby and you hand it to the japa maid and you get dressed up for a party and you're only picking the baby when you have to breastfeed, you will not make milk. So the first 30-40 days, you have to work hard to get the milk supply established. Once it's established, then it's an easy job. So please do breastfeed. Then coming on to the issue of, and I want to pick this up here, is alcohol consumption. Indian women are taking on to alcohol in a big way. And alcohol is linked to breast cancer. So I'm always the party popper. But it is, did you know, alcohol is listed as a poison by WHO. So if somebody asks me, हम कितना alcohol पी सकते हैं, I tell them I can't tell you how much poison to have. So yes, once in a while is okay, but please don't binge drink. It does affect your health. And because I believe God is man, alcohol affects women in a much worse way than it affects men. So, you know, you have to be a bit extra careful when you hold your glass. Then maintaining the right weight and exercising is not a fad that, you know, sab bolte hain, वजन कम करो, अच्छा खाओ. It's not a fad. It actually plays a role, especially for postmenopausal women. Higher body weight is associated with higher risk of breast cancer. Higher body weight after treatment of breast cancer is associated with higher risk of the disease coming back. So we actually spend a lot of time counseling women in clinic about the need for weight control and exercise. And that is why, you know, cancer centers the world over have picked on yoga and exercise treatment for cancer patients. Why? Because it does make a difference. Okay. Then coming to diet, which is my biggest pet peeve. So I believe strongly that when food becomes an industry, it plays havoc with your body. Okay. If you eat seasonal, local, fresh, you are less likely to get disease than if you get the banana, which has a sticker called Happy Banana and it's come all the way from Africa. Or if in the middle of winters, you're having mangoes that have been ripened because of chemicals, or you're having simple food stuff which is laced with insecticide and pesticide. So, Chavi, at least I am old enough to remember that when I was young, when we had atta in the house, it had to be passed through a sieve क्योंकि उसमें कीड़े होते थे. When we used to get matar and gobi and bengan, उनमें कीड़े निकलते थे. Now you don't find pests in your food. Why? Because there are chemicals like pesticides and insecticides. In fact, there was a study to show that the flour that you eat at home, जो आटा हम खाते हैं, उसमें DDT residue up to 5% होता है, and that is not healthy for you, you know. So I believe in organic. I know a lot of people don't, but when I say organic, I mean chemical free, residue free. I'm not saying you know, the pure, proper organic, because that is not a sustainable model of agriculture. But at least chemical free, residue free. Please eat seasonal. 30% or 40% of what you eat in a day should be raw in the form of vegetables, salads, and fruit. Okay. आजकल क्या होता है, बच्चे को भूख लगती है, they are given कुरकुरे. I remember हमारे घरों में birthday parties होती थी as kids. There used to be sandwiches with vegetables in it, things like that. आजकल क्या है, all these snacks that are coming out of packets. Also, plastics. So I'd like to point out here, Chavi, I don't know if you've bought a plastic bottle recently. I saw you drinking through a plastic bottle. It must have a sticker which says BPA free. Okay. Till about a few years ago, we didn't even know what BPA was, but it was entering our
Yeah.
system. Yeah, because it's a chemical that can play havoc. So there is something known as endocrine mimickers. ये जितने भी केमिकल्स की मैं बात कर रही हूँ, ये आपकी बॉडी में जाके आपके फीमेल हार्मोन को मिमिक करते हैं. And they cause this havoc, which is leading to PCOD, thyroid, cancer, and all these issues. So when you ask me what can we do to prevent breast cancer, you'll have to stop drinking, eating, and breathing, which you obviously can't do. So make the right choices in life. You know, eat out of utensils that your grandmother ate out of. Use steel, use iron. Don't use plastics. Don't use things which you don't know could leach. You know, why do they say food grade plastic? अभी तक तो कुछ था ही नहीं food grade plastic. Any
हाँ,
plastic
correct.
was good enough to put food and take home. So because when the consumer becomes aware, the person who is selling it starts putting these stickers to say it's not there. So awareness, it all boils down to awareness about what you're eating, drinking, awareness about how to lead a simple life, how to lead a life which is more in touch with your roots. And you know, nowadays these people have mushroomed, you know, the lifestyle advisors. वो क्या advise करते हैं आपको, बाजरे की रोटी खाओ, ज्वार की रोटी खाओ, Indian sabzi khao, Indian millet khao. But that is common sense that your grandmother told you, right? You suddenly decided olive oil was the best oil to cook in, whereas that is meant for the Mediterranean environment. So, you know, these are simple, basic things which I think conversation around these needs to happen in schools so that the younger generation that comes is more aware about all of this.
So what you're saying makes so much sense, and I'm somebody who completely follows all that you're saying. Not as much as what you're saying, but at least 70% I think I'm there, and little bit slip ups happen. But I want to tell all the viewers also कि ये सारी चीजें आप हेल्थ आपकी अच्छी रहेगी, फिट रहोगे, हेल्दी रहोगे, एनर्जेटिक रहोगे, and there's what is it stopping you from doing and making these lifestyle changes? And I think lifestyle is what we have every day. So once we get used to it, then it doesn't really make any difference. Once you start waking up at the same time, sleeping at taking and avoiding going to that restaurant and eating bana banaya kya bolte frozen khana. It's good. This is a rubber bottle. Is this okay?
I have a thing against plastic and rubber. I'm sorry, I noticed it, so I couldn't resist mentioning it.
That's okay. Okay, so अभी मुझे आप बताओ कि ट्रीटमेंट ऑप्शंस क्या-क्या होते हैं ब्रेस्ट कैंसर के?
So, you know, Chavi, the past decade has been very exciting in the field of cancer treatments, both diagnostics and treatments. So, you know, treatments can start from preventive stage, as I mentioned. So, agar aap mein genetic, so there are tests you can do to understand whether you have a genetic abnormality that can lead to increased risk of cancer. A word of caution here, because this is India and anybody can come selling any test at your doorstep. If you find somebody coming to you to say, or a test that says we will check all the genes in your body and tell you all the risks that you, I don't think that you should get these tests done unless you've spoken to your doctors, because a lot of times इनके results जो हैं वो doctors को भी interpret करने नहीं आते कि अच्छा इस gene में problem है, we don't know what your risk is. So then you have a sword dangling over your head. So starting from the preventive phase, for those who are gene positive, they can have breast removing surgery, ovary removing surgery, and reconstruction at the same time to make new breasts. so that they live their lives with organs that are not at a risk of making cancer. Okay. Once cancer is diagnosed, depending on the stage at which that is diagnosed, बट मोस्टली कैंसर के लिए खाली एक चीज से इलाज नहीं हो सकता कि आप बोलो कि खाली टैबलेट दे दो या खाली सर्जरी कर दो. For breast cancer, there are 4 things. There's surgery, there's chemotherapy, there's radiotherapy, and there are hormone blockade tablets. Most women will need at least 2 of these treatments, minimum of 2, most of them, so that, we can also reduce the risk of them making the cancer again. अब सर्जिकल ऑप्शंस में पहले तो एक ही ऑप्शन होती थी, पूरी ब्रेस्ट निकाल दो, आर्मपिट के सारे लिम्फ नोड्स निकाल दो, देयर वाज नो अदर ऑप्शन. बट नाउ द फील्ड ऑफ सर्जरी इज वेरी एक्साइटिंग. We can take little parts of the lump out and save the breast, keep the shape and size of the breast as normal as it was before, sometimes even make it better. So if somebody had a very large breast and she develops a cancer, we can actually make it small and more cosmetic, and also match the other side so that she's left after a diagnosis of cancer with better breasts than she had before the diagnosis of cancer. Okay. So, and in women who need to have the breast removed, we have the option of making a new breast by either using fat and muscle from other parts of her own body, or by using silicone implants so that she feels and looks normal. In the world of chemotherapy, which is medical treatment for breast cancer, again, we have become more and more targeted. Pehle kya hota tha? There used to be generalized chemotherapy, but now for certain cancers, we are able to give targeted chemo, which attacks only the cells that are at risk of making the cancer and not the whole body. Then with radiotherapy, which is X-ray treatment, again, the machines have become so advanced. So about 50, 60 years ago, radiation could cause damage to the underlying lung and heart. But now they have become so highly computerized that it calculates to 100th, 1000th of a millimeter the depth to which the radiation is going. So अगर आपकी chest wall को radiation मिल रही है, तो अंदर lung और heart damage नहीं होते. So treatment options are many, but always understand, please discuss with your doctor about these treatment options. And Chavi, as I had mentioned, that in India, sadly, a lot of young women do get breast cancer. So treatment of breast cancer like chemotherapy can affect your ovaries and can affect your fertility. So if a young girl who has not completed her family gets breast cancer, then we motivate them to talk about preserving their ova, saving their ovaries, so that 5 years down the line, 6 years down the line, if they want to have a baby, we don't have an oops scenario to say, oops, humne to chemo de diya, ovaries functional nahi hai, So there is that facility also. And I think the most exciting thing that has happened with breast cancer treatment, or for all cancer treatments, is that we as doctors have realized that it's a very holistic approach. It's not कि मेरे पास कोई breast cancer लेके आया, चलो जी table पे लेटो breast निकालो. It's very holistic. We understand the psychology of the patient. We understand where she's coming from. We understand whether she wants the breast saved, whether she wants a new breast made. How do we help her with fertility issues? A lot of treatments with breast cancer can lead to hormonal changes, and that can affect the sexuality. So we are more open about talking about that. So I think this holistic, multidisciplinary approach that we are taking as specialist units has made a huge difference in the lives of women being treated with breast cancer. And I'll tell you an example of a 37-year-old patient I treated. She's a marathon runner. So she told me, don't tell me to stop running throughout my treatment. And will you believe it? This girl got a wig when because of chemo, she'd lost her hair. Her mother-in-law, who stayed in the same house, did not know that this girl was having chemotherapy because her wig was so natural looking. Every third day, I would get a message to say, doctor, can I run 10K today? While she was having chemo. So that's the spirit. Cancer treatments have become very simple. And, a lot of it is up here. Yes, your body deals with it, but if your mind is strong enough, you can continue to lead a near normal life. And I know a lot of women don't come for treatment or early diagnosis because they're scared of treatments. And I really want to send this message out that agar aapka cancer samay pe pakda jayega, so you can have your treatments without anybody knowing that you have cancer if you don't want to let anybody know, because there are so many ways that we can support you with it. And after treatments, we see most women live better lives than they've lived before. They're conscious of what they're eating. They're conscious about exercise and things like that. So please always understand, come in time, and you can definitely win this war against cancer that we are facing.
So tell me that you said that जब young girls को cancer होता है, breast cancer होता है, then it can affect their ability of fertility later, right?
Hmm.
You also mentioned that there's hair loss because of chemo. What are the other side effects that one should expect?
So these are the major side effects which most women, the first thing we always get asked is baal jayenge kya? So hair does go, but there are options of wigs and caps. And I promise you, hair comes back, and most of the times it's better than the one that you had before. So don't worry, number one. So chemo, because general chemo, so targeted chemo will not cause that many side effects in the body, but the routine chemo that we give leads to your immunity being lowered. So you have to live a life of precaution during the time that you're having the chemo, which means bahar ka khana pina nahi hai. You don't have to go into very crowded places. If somebody in your house has khansi zukam, you have to stay away from them. That's the main thing. For some patients, their blood counts drop dramatically, जिससे कि infection का risk बढ़ जाता है, so they may need admission. Very rarely, chemo can affect the heart, and for that, obviously, the doctors keep checking their heart through certain tests. And if chemo becomes risky for the patient, then we stop it. We don't give it. But that's unusual to happen. Ajkal, drugs have become very safe, and most women are able to take their treatments without the fear of severe complications.
और ये सारी जो complications हैं, ये सिर्फ जब तक कीमो चल रहा है तब तक रहती हैं. उसके बाद they
Absolutely.
fade away. That's
So
good.
all of I and I'm glad you said that, because I say this in my clinic ad nauseum. I say this again and again. Any side effect of treatment is temporary. You will get back to normal. But agar aap time pe treatment nahi loge, the side effect of the disease is permanent, which could lead to you losing your life. So it's so
Hmm.
important.
Okay, so these are all the questions that I had. Now I'm going to be moving on to audience questions. I already have a list of questions ready. Anything you want to add before that, doctor? Or should I
I
start the
think you've
audience
spoken
questions?
enough.
Okay.
I'll wait to answer.
It's okay. So this person wants to know, is it true that due to vaccination, chances of cancer spreading is high due to lymph nodes enlargement?
No, so I'm glad somebody asked this question. So the thing is, what happened was that जब ये COVID का vaccine हम दे रहे हैं, because it is increasing your immunity towards the disease, it led to lymph nodes in the armpit and the other parts of the body becoming slightly bigger. Lymph node क्या होते हैं? They are policemen in your body, okay? And infection या जब हम immunity mount करते हैं, तो they can become larger in size. So what was happening was that on the routine mammograms that women were having, we were seeing enlarged lymph nodes in the armpit. So this is not that cancer is spreading or cancer is developing. This is just a temporary side effect. I won't even call it a side effect. It's a sequelae of vaccination. So वो with some time वो settle हो जाता है.
और ये कोई पूछना चाहती है कि ब्रेस्ट फीडिंग के बाद भी ब्रेस्ट कैंसर हो सकता है. एंड आई आल्सो हैव अ
Yes.
क्वेश्चन कि ब्रेस्ट कैंसर डज दैट अफेक्ट ब्रेस्ट फीडिंग आल्सो?
No, not really. So we've taken women through pregnant women through chemo and through breastfeeding their kids. So that doesn't get affected. देखिए क्या है कि हम बोलते हैं कि जितने बच्चे, the more kids you have, the more you breastfeed, the lesser your risk. But it doesn't become zero. So sometimes we see women in clinic with 8, 9 kids, जिनको सबको दूध पिलाया, but they still get breast cancer. Why? Because I said it is multifactorial. It is not because of one cause. Something else could have caused it. But yes, breastfeeding से risk कम होता है, zero कभी भी नहीं होता.
ओके, एंड दिस पर्सन वांट्स टू नो कि कौन सी एज तक मैमोग्राम्स करवाने चाहिए?
So mammograms Indian scenario में हम बोलते हैं 40 से शुरू कीजिए. Every year or once every 2 years, depending on what your doctor thinks is right. And till the age that you are healthy. So 70, 75 tak, because even women in 70 are now, they're not the 70 that we had 20 years ago. So, as long as you're healthy and you're moving around, you're active, you should continue to get mammograms. 40 to 55 tak once a year, uske baad once every 2 years.
Okay. I just one question popped into my head that if somebody gets breast cancer at an early age, okay, we are able to save the ovaries and pregnancy is viable, but the breast was removed.
Hmm.
Does that affect breastfeeding? Because you also mentioned reforming the breasts and
So,
reconstruction.
okay, so the if we have saved the breast and we have not removed it, we will do radiotherapy to the breast. So when you have a baby, you may not be able to make milk in that breast. Okay. Although some women will have some milk production, but it will not be normal. If the breast has been completely removed, please remember that the new breast that we make is purely cosmetic. It has zero function as a breast. So obviously you will not make milk. So a lot of times, sometimes say if we diagnose a woman with breast cancer when she's 9 months pregnant and she has to have treatment, so sometimes we will actually stop her breastfeeding by giving her medication for
Okay.
that. Okay.
Okay, now this person wants to know, does using birth control pills cause breast cancer? And also there's a pill called after 72. Does that also cause breast cancer?
So there is no direct link of oral contraceptive pills with breast cancer. But any hormonal medication should not be taken for a very long period of time because, especially for those who have a family history of breast cancer, we are not happy to give oral contraceptive pills. So, आजकल तो every young girl has PCOD, every young girl is being given oral contraceptive pills. So, if you take it for a short duration of time and your doctor thinks it's okay to take, then you can take it, but longer duration is not recommended, although there is no direct cause effect link.
But there must be other side effects also of taking these
Absolutely.
pills for a
There's so
long
many
duration.
things that even we don't understand. So, I always say that, as long as whatever medication you take should be taken only for the duration of time that it's really needed. Don't continue. I've seen women who are on oral contraceptive pills for 20 years, 25 years. So obviously it will cause some harm in your body. But if it's being taken for a short duration, and even the morning after pill, it doesn't increase your risk.
Hmm. Okay, if I have fibrocystic breasts, am I at higher risk for breast cancer?
So, fibrocystic is a term that is used for the texture of the breast. It is not a disease. Okay, so the texture, जैसे किसी का skin soft है, किसी का skin pimpled है, किसी का pore खुला है, किसी का कम है. Similarly, some breasts are fatty and some have fibrocystic changes, which means they make tiny, tiny water lumps within the breast. It is not associated with an increased risk of breast cancer, but the problem is that because such breasts tend to be more lumpy, so if you make a lump that is cancer, the chance of missing it becomes higher because वो शेर आया वाली बात हो जाती है. मेरी तो breast lumpy है, so ये भी जो मुझे feel हो रहा है ये कुछ fibrocystic ही होगा और वो cancer होता है. So that is the kind of risk that you have. So generally what happens is women with very dense breasts, fibrocystic breasts, end up being on more routine, regular follow-up in clinic, not because we are worried they will make a cancer, but because we are worried if they make a cancer, we will miss it if we are not being careful.
Okay, okay. This is a similar question on PCOD. What are my chances of having breast cancer if I have PCOD and I also take regular medication for this?
So again, PCOD is a disease for which you are not given medication for life, right? It's given for a certain
Hmm.
period of time. So if your PCOD is severe and your doctor really feels that you need it, then you must take it. Okay. PCOD is not linked to breast cancer, and the treatment for PCOD is not directly linked to breast cancer. But a word of caution again here, the slightest sign of could be PCOS and then taking treatments is not right. So if you think you have PCOS or PCOD, then you must always visit a specialist and understand, do you need lifestyle change to control it or do you really need medication to control it? Only
Yeah.
then should you be put on medication because again PCOS is a lifestyle disease.
Hmm. Okay, if someone who had an infection in the uterus which had to be removed to avoid any risk of cancer, are they at risk of getting breast cancer in the future?
No, uterine pathology is not linked with breast cancer, but ovarian is. So, if you had a cancer in the ovary or a high risk lesion in the ovary, then you could be at a higher risk of making something in the breast. So, that is why the genetic test is done. Also, Sometimes in a default kind of a way, if your uterus and ovaries have been removed, it could be slightly protective for breast cancer because your hormones have been
Okay.
reduced. Yeah. So for women who have hormone sensitive breast cancer, we actually shut down their ovaries because we want to deplete their body of the female hormone estrogen, which reduces their risk of cancer coming back.
So are there any hormonal tests as well that a woman should go through regularly?
No, not at all. We do not recommend.
Okay, this is a weird question. Drinking milk causes breast cancer?
It's actually not a weird question. This is such a big debate that even I fell for the debate, and for 3 years, my two little babies didn't get any milk to drink because I was so scared of feeding them milk. So the problem is not with milk. The problem is with the industry of milk, you know. So there was a Chinese study that was done many years ago because Chinese women have the lowest rates of breast cancer. Okay. Japanese women have very low rates of breast cancer. But if you take a Japanese woman and leave her in the UK for 5 years, her risk of breast cancer becomes the same as that of a British woman. Okay. So what the people who did this
Oh.
study, they looked at diet and they saw that Chinese and Japanese women take very little milk products. Whereas in the Western world, yogurt and cheese and milk are staples. So there was this link that was made. But I think the reason why we are scared of milk and breast cancer, although there is no definite proof of it, is that if the cows are being given too many hormones to make that extra milk production, that could come into your body and that could increase the risk. So I'll stand on the fence here and not say it causes breast cancer, but again, like the food and vegetables I'm telling you about, make sure you're getting it from a source that you trust.
Yeah. Yeah, even the milk, if you have your own personal cow, then it should be okay.
Yeah, in our little flats. But
Okay.
yeah, if you can go back to the old type of lifestyle, I think we'll all do the earth a lot of good.
Yeah, absolutely. So this woman wants to know, does IVF also cause breast cancer?
I'm being asked all very intelligent questions, which even doctors have no definite answers for. IVF directly does not cause breast cancer. We do end up seeing maybe slightly increased risk of breast cancer in women who've had multiple rounds of IVF. The reason could also be that because they've not had children and they've not breastfed, and that we know is a definite risk factor. But overstimulation of the body multiple times over could be risky. So we will not advise IVF in somebody who has a very strong family history of breast cancer because we don't know how the hormonal manipulation will work in their body. So discuss with your doctor. Everybody's risk has to be individualized, but IVF per se does not lead to breast cancer if it is done sensibly and for a limited number of cycles, not like you're having 20 IVF cycles to have the 21st be successful. That's the thing.
Mhm. So this is the last question. She says, I have fibrocystic breasts. One of my nipple is going inwards. When I checked with my gynac, she said it's not nipple inversion, it's nipple folding and happens because breast don't have muscles. Nipple comes out. What should I do?
So the breast does not have any muscle. It is purely an organ of fat and gland. But it has, what happens is that there is something called duct ectasia, which means that age ke saath, jo duct ki length hai, that becomes shorter. So when it becomes wider and shorter, it pulls the nipple inwards. Okay. And that can cause what we call a retractile nipple. Ki nipple अंदर की तरफ गई, but when you pull it out, it comes out. Cancer से अंदर गई हुई nipple बाहर नहीं आती है. Okay. So, yes, you've met with your gynac and she's
Okay.
probably told you the right thing, but it might be a good idea to visit a breast specialist or a general surgeon once just to be doubly sure. But it does sound like it's duct ectasia, which is not cancer.
So that was it. And I want to say I can speak for myself that I had an amazing time speaking to you, doctor. There is so many things that you have told me which I don't know, and I'm a mother of a girl. I think it's very important for mothers, especially, to be aware of these things so we can be
Totally
aware
agree.
and we can make our daughters aware. And I hope the audience also resonates with my thinking here when I say that. Thank you so much, doctor, for joining us. I hope the audience also had fun. And and you had fun.
Yeah, thank you so much, Chavi. I love doing this. I love talking about breast cancer and spreading awareness. So even if I've helped one person through this talk, I feel my job is done. And for all those who've heard, I tell them just spread the message. Just pick up your WhatsApp instead of sending a good morning message. Send a message to your friends to say, "Did you check your breasts? When was the last time you checked your breast?" If you're 40 and above, just send a message to your friends to say, "When was the last time you had a mammogram?" Let's give each other that kind of support. It's very important.
Thank
Thank
you.
you.
Thank you so
It
much,
was a
doctor.
great
And this
session.
is
Thank you.
thank you. Thank you. And I hope that the audience will join us again the next time, policybazaar.com. We keep doing these sessions for your good, and we also learn a lot from the sessions. So join us in next well.